Welcome to Chai with Manju, with your host, Dr. Manju Sheth.
Welcome to this special edition of Chai with Manju called COVID Diaries. While this pandemic has affected all of us differently, we do have three things in common. We are all in social isolation. We are all on camera in some form, talking to our family, friends, as well as employers even on camera. And third, we all want to look good. So we thought we'll get three experts in a very timely manner to tell us some good things about skincare, anti-aging, as well as about some procedures so we can learn from it so that we look good on as well as off camera. Our three experts today are Dr. Sonal Pandya, well-known plastic surgeon at Leahy, Dr. Rosie Sandhu, who has 3 med spas in Linfield, Winchester, as well as Somerville, and Dr. Shantala Shivananjappa, who has a laser and med spa in Peabody. Let's meet them and get some tips. Hello and welcome to the show, guys. My first question to all of you is related to the pandemic. We are all washing hands, using antibacterials with 60% alcohol. We are touching our face, we are wearing our mask, and essentially we are drying our skin. So do you have any tips for our viewers to use any either over-the-counter products, drugstore products, or anything that we have at home and our kitchen that can make us look good? So my first question, I'm going to start with Shantala. Hi, Shantala.
Thank you. It's such an honor to be with you guys, 3 beautiful doctors here. So this is a very, very important question. And, you're asking us related to skincare during COVID, wearing the PPE all the time, you're inside the house stuck here. And so if I have to pick one product, that would be sunscreen. People are really underestimate the damage caused by the sun. So it's really essential to protect our skin from the sun. And second thing is, it's all about prevention. Remember, prevention is better than cure. So before we really talk about correction and maintenance, we have to prevent it from happening. So I prefer the sunscreen. Like now you probably wonder what's a favorite sunscreen, how do I choose? So when it comes to choosing the sunscreen, the most important thing is to really look at the ingredients. So there are 2 main ingredients, like zinc and titanium are considered physical block. It really gives you 99% protection from the sun damage. There are so many ingredients in the sunblock, not all of them give you good protection, so, and also make sure that it is tinted. Because like I'm dark and then I need to make sure that when I use the sunscreen, it suits my skin color. Otherwise, I'm not going to wear it. And the second thing is the tinted sunscreen also has iron in it. And the iron really helps with, pigmentation, especially for Indian skin. Like there's a lot of melasma and things like that. And always wear a hat and then, put a UV shield in your car. And, my favorite products are IT Cosmetics or IT Cosmetics. It has the highest amount of zinc and titanium. Color Science, and even Neutrogena. It doesn't have to be more than 35, 50 SPF. So I hope it was helpful.
It's very helpful. And what about you, Rosie? Any tips from you?
So I think as far as skin is concerned, because of the quarantine and COVID-19 pandemic, there has been some good things for our skin because we are not outdoors as much and we are not using makeup as much as we used to. So finally, our skin has had a chance to breathe. So that way, I feel there's less congestion. Skin has really become healthy. On the downside, with the frequent hand washing, concerns like eczema, excessive drying, itching of our hands especially, has really become a problem for a lot of people. And this is especially worse for our elderly, for people with diabetes who have neuropathy and weak skin protection to begin with. Secondly, our frontline workers who are wearing masks most of the time, they are struggling with acne because when under the mask, the humid air that we exhale really gives, it's a great home for bacteria to grow and cause acne. And hyperpigmentation or dark spots on ethnic skin, we are very prone to hyperpigmentation anyways.
Right.
So I think those are the concerns we have to really combat. And my suggestion would be especially for excessive dryness of the hands, to use something that has an emollient and ceramide. It has to be a thicker product, not just the moisturizers we're using for our faces, because the skin of the hand is thicker. So over the counter, I really like, in fact, I keep it with me all the time, Gold Bond Eczema Relief 2% Colloidal Oatmeal. That's a great one. And then Neutrogena, Aveeno, even Aquaphor. Plain old Aquaphor is great for keeping your hands really high moisturized, because we need something that'll give that barrier protection.
Okay, sounds good. And what about you, Sonal?
I think that, whatever the skin type and whatever the age or gender, the importance of good skincare cannot be underestimated. So I want to talk a little bit about skin maintenance. And this is good for men and women. And this is an excellent time to either continue your skincare or recommit to a good program, or even commit to a new type of program. And you can tailor it or individualize it according to your needs, according to how many products you want to use. And what's more important is really the ingredients, not really the brand as much. And if you look at the attached chart, I wanted to kind of just go over key ingredients that are good to incorporate or integrate into your skin regime. Obviously, daily cleansing and exfoliating. For an exfoliation, you can use a scrub and do that 2 or 3 times a week. One of the most popular ingredients today is vitamin C. And this is a very powerful antioxidant. It's a very popular ingredient in most skincare products. I like it in a serum form, and a lot of brands have this serum. This is one of the best brighteners of the skin. So it's an antioxidant that helps brighten the skin. And by using it every day, you help with brown spots, fading any surface irregularities, helping with fine lines. And the serums often give a nice sheen and a luster to the skin. Another good product is the retinol, or the prescription strength retin-A, which you see at the bottom of the list. And this is one of the oldest time-tested anti-aging products. I should mention that this can irritate the skin. So if you are wearing PPE, it's probably not a good time to start it. But if you are just at home, it's an excellent time to start it. Because this really stimulates collagen, which is one of the key ingredients for good elasticity of the skin. So this is an excellent ingredient to really start either the over-the-counter retinol or the prescription strength retin-A. Another excellent product is hyaluronic acid, which again is usually present in a serum form. This is one of the very native ground substances in our body, and it's a hygroscopic agent, which means it absorbs water. And so using it on our skin tends to absorb moisture, and it keeps the skin plump. And in that sense, you don't see the fine lines as well. So it's an excellent agent to just try to soften fine lines and add a nice luster to the skin as well. There are a lot of other skincare products, which if you want to get more involved, peptides and acids and growth factors, which can also be tailored. But I think these products are sort of very basic. And then of course, round up everything with a good moisturizer. In the prescription strength agents, the other thing is a 4% hydroquinone, which is used for brown spots, again, for those people who want to treat hyperpigmentation.
Wonderful, wonderful tips. So that takes me to our next question. In medicine, we tend to divide everything in sections. And since we are focusing on the face today, of course, we kind of divide it into upper, middle, and lower. So once again, actually, I'm going to call upon you, Sonal, to tell us how to have our upper part of the face look fantastic.
So there's been a lot of focus on the upper part of the face, because that's really the only part of the face we've been seeing with all our masks. Right. Again, these recommendations are and complaints are both from men and women. And I think one of the most popular agents for the upper face is Botox, which is Botox and other neuromodulators, which help to basically treat the muscles that cause wrinkling and creasing. So Botox tends to relax these muscles. If you look at the attached picture, again, the most common lines that people complain about are our frown lines, or the 11s between the eyes, our worry lines, or the horizontal lines on the forehead, and our smile line. So I always say that Botox is best for your frown, worry, and smile lines. I should point out that it doesn't have to be overdone. It can be done in very small doses that nobody can really even tell that you've had something done. It relaxes the face, it's preventative, and it's a simple procedure that takes, a few minutes in the office, lasts about 3 to 6 months. And because it's preventing these muscles from overacting, the upper face just looks smoother. So incredibly popular. And again, as I said, preventative as well. The other common complaint for the upper face is the upper eyelid, which again, if you see the picture attached, a lot of patients complain about hooding or sagging of the upper eyelid, which makes them look either tired or older than they are, or there's no room for makeup, or sometimes it even obstructs their visual fields, especially when they're driving. And I think this is one procedure where surgery is a good option. It's called an upper eyelid blepharoplasty, and just excising that extra bit of skin does not change how you look. It's a simple procedure. It's less than an hour. It can be done either under local anesthesia or general anesthesia. The downtime is 1 to 2 weeks. The scar hides very nicely in the crease. And again, it makes you look more youthful. You look the same, maybe just 10 years younger, without people even being aware that you've had surgery. I think that's one of the most popular surgical procedures for the upper eyelids.
I like the idea of looking 10 years younger.
Yeah, without looking different, that's key, or done.
All right, going to you, Rosie, any ideas about making this part look 10 years younger as well?
Absolutely. I think if you just stay focused on the 10 years younger, if you were to do one procedure that can instantly, I think, take 10 years off of your face, it is for the right person, under eye filler. Because what we see is, as you know, our eyes are the windows to our soul. So you look the most tired and really stressed out when there is hollowing or dark circles under your eyes. So I think that is the number one complaint my patients come to see me and most of us for, that they look tired. They just don't, they look older than they feel. So if we address this area really well, we can really help them a lot. So fillers are really hyaluronic acid. There are different kinds of fillers, but the most frequently used ones are hyaluronic acid fillers like Restylane or Juvederm. And these are in-office procedures that we do them while you're awake without really any downtime. And what happens is we get dark circles because of usually one of three reasons. Either as we are aging, the underlying support structure and fat is going away, we're losing it. Or because of our ethnic skin color, and all of us have melanin, the pigment producing molecule. It can produce excessively and cause darkness, hyperpigmentation under the eyes. Or thirdly, because of the skin is thin and the bluish veins can overshow, which is less of a concern for us as much as for Caucasians. So what we just have to see what the underlying concern is, and if it's hyperpigmentation, then we have to resort to resurfacing lasers or peels, or as Sonal said, vitamin C or retinols to really try and resurface the skin. But if it is because of hollowness, then we can inject this sugar-based hyaluronic acid with a very fine needle or a blunt cannula and really fill and restore that lost volume, giving a very youthful look, which can last for about a year or so.
How many years or so?
1 year or so.
1 year or so.
So it's really, it's done in 15 minutes and people can get back to their usual activities. There's really no downtime and you look good for about 1 year.
I'll take the 10 years younger look from you as well. Now, Shantala, how about you? Let's go to the lower part of the face. So give us your tips.
This is the hardest part of the face, Manju. It's not that simple. So because what happens, like, aging is multifactorial. It's a three-dimensional. It's like you lose, even the skull kind of shrinks and you lose collagen. Your skin is like a stretched elastic, and all the beautiful little tiny pockets of fat in your upper face and the mid face, they all shrink and they actually come down. So everything what is beautiful in the upper and the mid face all comes to the bottom of the face. So it's not that easy to really treat the lower face. So I think, the main, the way I would really try to explain is, okay, let's talk about what's happening. Number one, you're losing the collagen. There is a lot of laxity and the skin is sagging. Number two, the volume which is there in the upper face and the mid face is coming. So you have more volume. That's why the jowls and, people are, I don't like the way, the way it looks. So when it comes to lower face, it's really essential to understand it's all about stimulating that collagen and building that collagen back. So, we can't be using volumizing fillers like the mid face. It has to be like a biostimulator filler. Some of these fillers, they stimulate collagen. They don't give you volume. And other way you can really stimulate collagen is by using heat-based devices, whether it is lasers or radio frequency or ultrasound-based devices like therapy, or even PDO threads, or there are a bunch of threads. These are absorbable sutures which can stimulate collagen. So these are some different ways you can really rejuvenate your lower face. I mean, when it comes to skin brightening, like pigmentations, like, we as Indians are more prone for PIH and melasma and sun damage. So we have to be very careful with lasers, because there is no cure for melasma. The more we do it, the more it can come back. And then, so people have to be very careful with these lasers. I mean, one other thing I can talk about in the lower face, the masseter during COVID, or in general, people get stressed and they clench their teeth. Some people grind, some people put the dental guard. So that can damage your teeth, and also it can cause premature aging. So you can actually do some Botox for the masseter muscle and relax the muscle, so that it'll really help you in the long run. And don't forget, your neck and chest is as important as any other part. So I actually put the product in the back of the hand, and then put it all in the neck and the chest, because the skin in the neck and the chest is so thin and it ages fast. So it's really essential to focus on the neck and the chest. I mean, you don't want to look good here and not look good here. So, and the last, but the least one is the sweating. When we get stressed, people sweat, and it can cause fungal infection. It can be, problems. So you can actually treat with Botox, whether it's hand sweating or the axilla. These are some of my, tips.
Excellent. I think after listening to this, so many people are going to want to go to the med spas. But of course, there's that fear as well because of the pandemic. So people who now want to get started first time, or many of you have regular patients as well, what kind of precautions you are taking? Because, I'm going to start with Rosie, because you, of course, have 3 spas, as I mentioned in my introduction, in Winchester, Somerville, and Linfield. So how are you setting it all up so patients, when they come back, they feel safe to come back and get things done?
Right. We just, so of course, safety for not just the patients, but our staff is paramount importance. So what we are doing is following CDC guidelines. I think the biggest change for us during this time and beyond this time is going to be telehealth and virtual consultations. Right. So mostly what in my office, what I've decided, and I don't know why I didn't see this before, I think virtual consultations are huge. They're great. It's so convenient for the patient. They don't have to come drive all the while, and they don't have to sit in the waiting rooms and wait. So I think there's definitely, that will be one thing we will be doing. The initial consultation will be a virtual consultation where we can find out more about what their concerns are, if we can give them a good solution to it, so that the time in the office is as reduced as we can do. And most of the consent forms will be mailed to patients electronically. Post instructions. Our goals will be to minimize time in the office, so that the chances of getting any kind of infection is least. Secondly, of course, we'll be hand sanitizing stations everywhere. We have made it a policy that at a time in our office, there will be only 1 patient. So we are making sure that there is nobody waiting in the waiting room at any time. We're taking it pretty seriously. So when the patient arrives to our office, they actually don't even arrive. They call us from their car to tell us they are ready. And when we are ready to take them, we'll call them back and tell them, okay, come straight up. And once they are in, they are not sitting in the waiting room. We are escorting them straight to the treatment room. And that's where we are just getting their intake. There will be, of course, questionnaires and checklists. We want to make sure they were not, they didn't have any symptoms. And once we do all that, the checkout process is also going to be in the same room. So there really will be no person-to-person contact beyond what is really needed.
That sounds good. And Shantala, you of course own the Med Spa and Laser Center in Peabody. So what are the plans there? What are you incorporating as changes?
I mean, I'm doing all the things what Rosie mentioned as well. Yeah, I mean, completely abolishing the in-person consultation and changing to just a virtual consultation. And, luckily I also have like, quite a few rooms so that patients can just go to the room and then not have anyone in the waiting room, sit in the car, the same thing.
Right.
What other things? I can't stop thinking about. It's never ending,
Yeah, it's just, and how about you, Sona?
So for our non-surgical patients at the Cosmetic and Laser Center, we'll be following all the CDC and hospital guidelines, which is pretty much what both Rosie and Shantala have mentioned. I should add that all surgical patients will be getting a COVID test preoperatively 48 to 72 hours before. So when they come in for their preoperative testing, a COVID test is part and parcel of their workup as well.
Mm-hmm. That sounds very reassuring. I have to say that I can't let you guys go without especially asking about our guys, because we want our men to look good as well. So Rosie, any special tips for men to look good?
So everything that we are doing for women, I think the men have to just stop stealing product of their wives or significant others and get their own. But I think for men, the biggest issue is hair loss. So in our office, we focus a lot on male health and hair restoration, not only with hair supplements and vitamins, but also in-office treatments like PRP, hair restoration, or platelet-rich plasma, where we are actually taking their own blood, centrifuging it, separating their plasma, and injecting it in their scalp. And don't worry, it's pretty painless. We numb the scalp really nicely. And it works quite well. Most patients required about 2 treatments in a year or so, and they get very good results from it. I think the hair restoration is probably the most successful and popular procedure in our practice for men.
Okay. How about you, Shantala? Anything for guys?
I don't think men should look better than us. So
I agree with you there.
I think men naturally, they shave every day, so they're actually mechanically exfoliating their skin. Right. Maybe that's why they look better than us. But so
they look distinguished.
And then I think, son doesn't care whether, he's not going to spare, oh, he's a male, I'm not going to affect him. So the men has to use their sunscreen and protect their skin. But I do agree with Rosie, the most common procedure I do in my office is a lot of men like the lines in the forehead, Botox, and the hair loss treatment with PRP injections are extremely popular. And I do the PRP micro needling for skin rejuvenation. So that's another thing which because of the acne scars and so that's my patients love the treatment with micro needling PRP and for the hair as well.
Okay. What about you, Sonal? Any tips for men?
In our practice, I think we see men for a lot of the similar reasons we see women. For the upper face, it's pretty much the same. We use a lot of Botox on their frown, worry, and smile lines. The eyes, the upper eyelid hooding, for which, again, we do surgery. Bags under the eyes is a popular request for men. And unfortunately, till date, we don't really have any home run topical treatment or device for the lower eyelids. It's usually surgery to reposition the fat on the lower eyelid. And I think a lot of men also come in for some of the lower face sagging and fullness under the chin. And we use our various devices, or Kybella, which melts the fat under the skin, which is an injectable, or a submental liposuction, which is again liposuction under the chin.
Okay. Well, you've given us a lot of tips to look good on and off camera. So I thank you for that. And hopefully we will see you soon. And until we do, don't forget your chai. It's good for you. Thank you.
Thank you. Thank you.